That's a good question, and the reason is there are so many different tooth whitening systems out there. Some that work really amazingly, some that don't work at all, and there's a lot of those, and some in the middle there. It depends a little on what we're trying to achieve and also on the person's particular teeth. I use something called Kor Whitening system, K-O-R whitening. It used to be called deep bleaching, but the way it works is that we take all the things that we scientifically know work to whiten teeth, and we don't cut any corners. Most whitening systems are trying to cut corners because people want things faster, quicker, cheaper. Well, like most things, if you're getting them faster and cheaper, they're not going to work as well. And when people come to me and they say they want white teeth, I want to know that it's going to work. I can't tell you how many people have said they whitened their teeth in the past, either at a dental office or they bought something in a store or on Instagram with some blue light that does nothing, didn't get the results they were looking for. I can tell you Kor Whitening has worked every single time I've used it, and it works really well because, again, we're not cheating, we're not cutting corners. What we're using is we're using the best bleach. Bleach is shipped to us cold, it's kept in the refrigerator, and is kept in your refrigerator when we give it to you. Okay, bleach loses potency with heat, so especially in places like Texas, but really anywhere, you can get something shipped to you, or it can be sitting on a shelf somewhere, or it's in the back of the truck that might be 150 degrees, and it won't work at all. You can get two products, you're like, oh, I used it before, it worked really well. I got it again, now it's not working at all. What's the deal? It was probably kind of destroyed by heat and time. So that's one of the things. It's the best bleach we use, okay? We're also using time. Everyone wants us to try to do it faster. You're gonna see these things at the mall, we're gonna whiten your teeth in 1 hour. You're gonna get no lasting whitening in 1 hour. When your mouth is open, like this, and you just sit there for 20 minutes, okay, your teeth are gonna get whiter. You put a hair dryer in there and get them hotter, they're gonna get whiter. You put some bleach on there for 20 minutes, whip that there, and a blue light that heats up your teeth and dries them out, they're gonna get whiter for about 24 hours. Okay, after a few hours, the teeth all that's happening is the teeth are dehydrating and they look whiter. But then you get your saliva, you drink something, and the teeth rehydrate and they go back to the normal color. You can't whiten sufficiently a tooth an hour, it doesn't work. So you need time. With the Kor Whitening system, you're gonna be sleeping with some appliances we make to hold this potent bleach on your teeth for a minimum of 2 weeks, okay? It can be up to 4 or more if we have really dark or stained teeth, or if we're older. As we age, it's harder to whiten our teeth. Our teeth are made of millions of little pores. They get clogged with coffee and red wine, all types of dark things. Because that is harder to get the bleach in the tooth to whiten it. You have a teenager, you have a 20-something-year-old, most systems can work okay, but if you use the better system, it'll really work. But on patients that are older, we're talking about usually age 40 and older, or younger if we have really dark teeth, then we want to use only the best systems if we want to see a significant change on the whitening. So we're using time, we're sleeping with it, we're using the best bleach. The appliance we're putting it on our teeth with matters a lot, okay? Typically, you'll find some non-custom fit tray you buy in the store that fits on your teeth, the bleach leaks out, saliva leaks in. Saliva will destroy bleach and its potency within 20 minutes. So even if you have really good bleach, if it's not a good fitting appliance holding it on your teeth, it's going to lose its potency and not work very well at all. That's why things like little paintbrushes and lipsticks and all the little gadgets and really don't work that well. So the appliances, the Kor appliances, are kind of look similar to old school dental trays that are made in our back lab in every dental office. They've been done for 30 years. But they seal better. They seal and fit at the gum line better. So it keeps the bleach in, keeps saliva out. Okay, so we got the best fitting tray, we got time, we got the best bleach, and lastly, we're combining it with in-office bleaching. So it's always a combination of in-home for 2 to 4 weeks, usually 2 weeks on younger people, and then you're gonna sit in our chair for about an hour and a half, and we use a different type of bleach that we kind of mix together and activates right there, so it's a quicker, faster, stronger active bleach over a short period of time. So that's how Kor works. It always will be a drastic change. In my opinion, it's the best whitening. People always ask, will damage my teeth? No, it won't damage your teeth. Will it hurt? It can hurt, okay? Kor, even though it's the most powerful, is by far not the most sensitive. Some people will, about a third of my patients will have quite a bit of sensitivity. Like really hurts their teeth. They might have to take some Advil during those 2 weeks. A third, very little bit. They've noticed it, but it really not bothersome. And a third don't feel anything at all. It doesn't bother the sensitivity at all. Now, even the people that do have sensitivity, again, not damaging their teeth, and after you finish the process, that sensitivity will go away within a few days. So for some people, that's the price of beauty, is some temporary sensitivity there. So that's why I use Kor Whitening. I'm not a fan of any of them with the blue lights or the blue lights have been shown for decades. The scientific studies show that long term there will be no benefit from using the blue light. There'll be initial, like the first day, you'll think it helped a lot and then you kind of forget about it, but as it kind of gradually goes back to it and rehydrates, but it's not helping. It's just a gimmick that they've been, unfortunately, the dental and now spas and malls have been using and are still using for the billion-dollar companies that are still doing this for many years. In my opinion, it's not beneficial, so we don't use that. We use all the things that's science-based, we know that worked, and have a long track record. So that's why I use Kor Whitening.